Today in this video, we're going to talk about genetic disorders and Ayurveda. We often receive a question that with this modern growth and modern technology, how are you based on this ancient science and what does it really emphasize about the genetic disorders? How are you so confident to say that the ichthyosis will not be transferred, the psoriasis will not be transferred? How are you so confident that these genetic disorders can be cured? How are you so confident? And again, we openly inform and we tell the patients that visit Jyovis and connect with the patients to know their journey, to experience how they experience the miracles and glories of Ayurveda. Where there is a genetic history of rheumatoid arthritis, where patients, they have a structure of the hands like this because of RA factor, and how after a treatment or during a treatment they experience it coming back to normal. Is it really possible? Welcome to Ayurveda. Can psoriasis be cured? Welcome to Ayurveda. If a finger is like this, can it become like this? Welcome to Ayurveda. How is it said with so confidence? What is the emphasis that Ayurveda has when it comes to genetic disorders? The entire 3 generations has arthritis. How can you be so sure that it can be solved? Patient can get relief. Why and how? Let's understand about the point of view of genetic disorders, its prevention, its preventive aspects for promotive health, as well as cure and a solution to minimize its risk, where we see every 13th child is autistic, where we see so many deaths because of congenital, hereditary and the genetic factors. Why and how? Let's understand in this video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. First, let's start this video by understanding the data. Data reveals that 3 to 5% of all births result in congenital malformations. 20 to 30% of all infant deaths are due to genetic disorders. 30 to 50% post-neonatal deaths are due to congenital malformations. 11.1% of pediatric admission, hospital pediatric admission is with those children who are having genetic disorders. 18.5% are those children with different kinds of congenital malformations. 50% of the mental retardation has a genetic base. Genetic base mental disorder. This is why we must know how we can reduce the risk of the mental problems. It is said that every 13th birth is an autistic child. Very sad and bad and upsetting to hear that there is no cure in the world today. Ayurveda has results. I don't talk about management here. We see improvements. We see visible improvements in cases of autism. Why and how? We have a video, but here we're going to talk about the congenital, the genetic problem. So let me tell you, I am sharing this data for us to have a sufficient knowledge, to have an awakening in our consciousness, to introspect and to find out that irrespective of whether this modern technology, which is the need of today's time, which is appreciable, which is need, which is super, which is something we must follow, but somewhere we are failing to reduce the risk of these little child, right? So somewhere we are reducing, failing to reduce the risk. And here comes a picture. Can we take off the science, take the help of the science of Ayurveda? So this first medical science, the ancient old medical system of medicine, Ayurveda, where the world has drawn attention, to if there is a science which is years and years old, which is the first medical science, if this science in today's time also provides results for incurable conditions with the miracles, with the glories that it has on patients physically, if this is a science that is still present and still beating disorders which are new, then there is definitely something we must think about, right? So in this science, it does not just lay attention, but it doesn't just have a preventive or promotive aspect, but it has a solution to minimize the risk. We've spoken in many of our videos, Ritushetra Ambu Beach, how the fertile period, how we can do the Kshetram Garbhashayam, how we can work on increasing the bulk of the uterus, how we can do the Stri Beach Shuddhikaran, the Purish Beach Shuddhikaran, do the Shuddhikaran, purification of the sperm and the ovum. We've spoken about it in detail. Today we're going to talk about what leads to genetic disorders, what was explained years ago. In Ayurveda, it was explained Shadagarbhakar Bhavas, 6 procreative factors that are responsible for a progeny. These 6 the procreative factors are Matruch, mother, Pitruch, father, Atmyaj, the soul, Satmyaj, wholesomeness, wholesome, Satvaj, which is the psyche, the mind, and last is the Rasaj, which is the nutritional. We see any of these factors or negligence can lead to defects or changes in the overall behavioral pattern or overall progeny. We see that research has spoken that the ahar, vihar and vichar, the diet, lifestyle and the vichar, the thinking of a mother before pregnancy, during pregnancy is directly responsible to the health of the child. Ayurveda systematically talks about these factors, which is the bij, ovum and sperm, bij bhag, which is the chromosome, and bij ghava, which is the genes of the parents, which is responsible to the healthy progeny. Ayurveda also talks about this very important concept, which is purva janma and the papa karma. We'll discuss in the further part of the video. Let me tell you, these 6 factors are very, very important. The ahar, vichar and vihar of the mother and the father, very, very important. Hence, this solution starts from preconception. In Ayurveda, it is mentioned more than being pregnant, it is about having a healthy pregnancy throughout 9 months. Having a healthy pregnancy in such a way that patients often tell us, am I even pregnant? The delivery is smooth, safe and painless. Super results when we choose Ayurveda. When patients across the globe today we see, irrespective of whether they have a problem or don't have a problem, they want their journey through Ayurveda, they want to follow the Ayurveda Garbha Sanskar, preconception, Garbhini Paricharya, Sutika Paricharya. So this journey starts from before conception, minimum 3 to 4 months, starts with Panchakarma, Vamana Virechan, Raktamokshan, Basti, Uttar Basti. 3 months Basti to be done at home, Uttar Basti, Raktamokshan to remove and eliminate the Aushnya, hot heat, pitta part from the Rakta. Raktamokshan, Virechan, Basti, Uttar Basti. Preconception regime. During pregnancy, certain medications for the mother, which is, certain medicines that are given to the mother, which is the month-wise development that we see of the child, we give those medicines to the mother. Mother and child connected through, the fetus connected through the umbilical cord. So, medicines for the mother, ahar, vihar and vichar, constantly working on these elements during the pregnancy. Post-pregnancy, Ayurveda is the only science that focuses on preventive, promotive and curative aspect for children from day one. Talks about Garbha Sanskar, Garbha Vidhis, Anna Sanskar, Anna Prashan, Swarna Prashan, Karana Vedan Sanskar, right from which day you need to show sunlight to the child, to the Karna Vedan, piercing ear, everything mentioned in Ayurveda. It is a very proud moment for me to tell you that every scholar has the emphasis on congenital disorders, explained years ago in Ayurveda. Every scholar, all the scholars. Now let's talk about the most important part of this video, where I want to tell you that Matruj, mother, Pitruj, father and Atmaj, which is soul, these 3 bhavas cannot be changed because they come from the parents and they come from the Purva Janma Sanskar, from their past deed, Purva Janma Sanskar, from their Purva Janma Sanskar, from their past deeds. So this cannot be changed. But the Rasaj, the Satmyaj and Satvaj can be changed, can be modified, can be practiced properly, and we see amazing results when it is followed. There is a proven research where the modern science talks about the environment which influences the genes, the internal environment and the external environment that has a direct influence on the genes. So through the Ayurveda Garbha Sanskar, through the rules and regulations, to the ahar, vihar and the vichar during pregnancy, before pregnancy has a direct impact on the healthy progeny, and we see the miracles of Ayurveda. Just imagine the autism, the stress, anxiety, the depression, the heart disorders, the psoriasis, diabetes, arthritis, all these can be minimized when patients follow the rules and regulations given in Ayurveda, what, why and how they should follow, they should do, they must know before, during and post pregnancy. So Ayurveda, one old ancient science which emphasizes on preventive, promotive and curative aspect when it comes to such genetic disorders. This is the viewpoint of Ayurveda. Any doubts, please do mention in the comment section, and do like and share this video further. I Hope you could relate, and I really want you to share your views. Until next time, from Jyovis and the team, look impressive, be progressive.